Hello, thank you for joining me this afternoon. So today's session is continuing last week's theme of diabetes mellitus, and last week we spoke about what is diabetes and what does it mean for a cat, what are the clinical signs of diabetes, how is it diagnosed. This week we're going to talk about management of diabetes. And as always, if you'd like a copy of the slides, feel free to drop an email and let us know. We can provide those for you. So what are the aims of treatment? What are the aims of management? And what does that mean? Well, broadly, I would say there are three aims of our management. The first one actually is, where possible, achieve diabetic remission. In other words, help the diabetes to, as it were, disappear. And I'll talk about that in a little bit of more detail in just a moment. Of course, in many cases, we can't make the diabetes go into remission. It's there and it's a permanent issue that we need to manage. And for those cats, then the priorities are, what can we do to remove the clinical signs of diabetes so that our cats are as well as possible, and hopefully living as long and happy and healthy a life as possible, and also making sure that we minimize, where possible, any complications of diabetes. And that might relate also to the treatment as well. And I'll talk about each of these things in turn, and hopefully all will become clear. So the first one, as I've said, is diabetic remission. And this is where our management, or indeed the cat's underlying disease processes, allow the diabetes to disappear. And there are all sorts of examples of why and when this might happen. And I've put a couple of examples on this slide, but there definitely are more. But to talk through the examples here, we have, you can see on the left-hand side, a very handsome, if rather overweight, let's not beat about the bush, cat, Mr. Bugs, who actually was a cat owned by a colleague of mine, so has a veterinary owner. Oops, on the weight front. And we knew for a long time, poor old Mr. Bugs, yes, he is a large cat, but he also is definitely prone to being overweight. And we had this little worry between us all that, yes, one day perhaps this would lead to diabetes, because as discussed last week, and as is the case in ourselves, we know obesity is a risk factor for development of diabetes. And lo and behold, when Mr. Bugs was in, I think, 7 or 8 years old, middle-aged, he did actually develop diabetes mellitus. But the good news was that actually in his case, through changing his diet to a diabetic diet, which we'll talk about a little bit later on, but also through helping him to lose some weight, we were able to put his diabetes into remission. So he was diabetic for a few months, and then following management along the sort of ways that we'll talk about in a moment, his diabetes essentially disappeared. And whilst he always remained vulnerable to going back into a diabetic state, essentially we were able to cure his diabetes as far as clinical signs were concerned. So that was a very good outcome. Another example of diabetic remission I've included here is this very poorly looking cat, Rosie, who is in this photo. She's in the hospital. She's on fluids. She looks pretty depressed. I mean, she's not sleeping because she's had a very vigorous day. She's just very, very sick. And she had a diabetes that was associated with a ketoacidotic crisis, this emergency diabetic scenario, which happens from time to time. Luckily, not too commonly in cats, but in her case, all of this was associated with pancreatitis, inflammation of her pancreas. The pancreas is the organ in the tummy that produces insulin. So, of course, when the pancreas is unwell, diabetes is always possible. But in her case, it was because of this very painful inflammatory condition, which made her feel absolutely terrible. But again, in her case, with aggressive management for her pancreatitis and also for her diabetes, what we found was that once her pancreatitis settled down, her diabetes also disappeared. And so she too, like Mr. Bugs, was on diabetic therapy for less than 3 months in total before she returned into diabetic remission. As I'll mention a little bit later on, cats that have become diabetic and then go into remission definitely always, in my opinion, remain vulnerable to returning to diabetes in the future. So in Mr. Bugs's case, of course, we wanted to make sure his weight management was successful for the rest of his life, because we knew that if he did become overweight again in the future, that he would be very vulnerable to tipping back into diabetes. Some other examples which I've not included on here of situations where diabetic remission is also quite likely would include cats that develop diabetes related to medication, for example, receiving high doses of glucocorticoid steroids for management of inflammatory disease. These cats also, if we can get them off the steroids, we've got a good chance of their diabetes disappearing. And even some cats just with a very standard diabetes, if we diagnose it early enough and we're able to treat it quite aggressively, we can help the pancreas recover and help that diabetes go into remission. So that is always our aim, and probably it is achievable in about a third to possibly half of cases, I would say typically. Some clinicians, some papers report higher rates of diabetic remission, but from my experience, I would say it's more like a third to possibly a half of the cases that I would see. So in those cases that remain diabetic, what other aims do we have? Well, we definitely, of course, want to ensure that our patients have as good a quality of life, and that therefore they're free, where possible, of the clinical signs of diabetes. And so, as we talked about last week, common clinical signs of diabetes would include an increase in thirst and increase in urination, because the kidneys can't keep that glucose in the body because the blood glucose levels are so high. Glucose is lost into the urine and it takes water with it, meaning that these poor cats produce large volumes of urine, and therefore they have to drink a lot, otherwise they will become dehydrated. So of course, in our well-managed diabetic cat, we want that thirst and urination to return to normal levels. Also for appetite to not be as ravenous. Many diabetic cats are very, very hungry. And because weight loss is a common feature of diabetes, a good outcome, of course, is going to be that we help our cat to maintain a healthy weight. So they're not losing weight or gaining weight, and their weight is healthy as far as we're concerned. And for the most part, achieving this resolution of clinical signs is through, for most cats, a combination of a special diet and insulin therapy, with the aim of keeping our blood glucose levels, our blood sugar levels, within a certain fairly narrow band, and that band below what we call the renal threshold, which is the level above which the kidneys start to lose glucose in the urine. So for most vets, and using the UK measurement system, which is glucose in millimoles per litre, that's keeping your blood glucose broadly between about 5 and about 12 millimoles for as much of the day as possible. And then the last important aim of our management is to avoid development of complications. So we want our patient, of course, to have the best possible outcome. So that means that firstly, we want to protect them where possible from complications of their diabetes. So we manage the diabetes, and hopefully that means that the cat's less likely to develop problems like the peripheral neuropathy I spoke about last week, where particularly the long nerves to the back legs are commonly affected, and cats can develop what's called a plantigrade stance, which is where they're walking with their hocks, which normally are well off the ground, but as per this picture, the hock right on the ground, because the nerve supplying the muscles of the back leg has been damaged, and therefore this sort of muscles aren't working as effectively as they should. And this is also something that can affect the front legs in what we call a palmigrade stance, where cats are walking essentially on the palm of their hand, which when they should be walking on their fingertips. We also, of course, want to prevent development of ketosis, which is where, because the cats can't use glucose, they start to break down fat and muscle and break this into ketones, which can be used as an energy source, and that's helpful in the very short term. But if that goes on for a long time, or there is a high production of ketones, then that also makes our cats extremely unwell. This is an emergency situation. Cats can die very quickly if they develop this ketosis. So again, if we can manage the blood glucose levels, we prevent ketosis from happening. And luckily, actually, cats are less vulnerable to ketosis than some other animals, such as dogs, are. And we also know cats with diabetes can be more vulnerable to urinary tract infections. So again, treatment of diabetes helps to prevent that from occurring. But importantly also, we want to make sure that our treatment isn't associated with causing additional problems. And really the key one here would be over-treatment. So using too high a dose of insulin and causing hypoglycemia, which is where the blood glucose levels go too low. And that, as you'll probably all will know, is extremely dangerous. You can kill a cat or a person or a dog by giving them an overdose of insulin, because the blood glucose will go extremely low, and that can cause seizures, and it can make you slip into a coma and of course die. So very importantly, with our diabetic cats, we need to make sure we don't give too much insulin. And that's one reason why, when we are stabilizing our diabetic cats, we always adjust the dose of insulin cautiously, as in by usually about half a unit at a time, but also slowly. You wouldn't increase the dose every day, even if it looks like the insulin's not really working, because it can suddenly have this cumulative effect and really cause a crisis. So we typically will say, when the dose needs to be changed, don't change it more than twice a week, so that we know that we're letting the sort of insulin levels level out, and we can see the impact of any change we've made before we make another change. So we'll talk more about insulin in just a moment, but first of all, I wanted to talk mainly about firstly the general approach, and then we'll start, I think, with diet. But overall, the general approach for cats with diabetes, the most successful management strategy, involves a combination of things. It involves firstly a therapeutic diabetic diet where possible. Secondly, insulin makes a big difference to your success rate. And then thirdly, it's addressing any predisposing factors or causes which can be addressed. And that would include things like the glucocorticoid steroid treatment I mentioned a few minutes ago. So if the cat is receiving anti-inflammatory glucocorticoids and that has perhaps precipitated the diabetes, if we as clinicians can recommend an alternative treatment that will treat the inflammatory condition but is not a steroid, that is better, because then we can remove that glucocorticoid and hopefully the cat will regain their ability to control their glucose levels and the diabetes will disappear. And similarly, as you saw with Mr. Bugs, weight loss was very effective in him in resolving his diabetes. So if there are predisposing factors that we can address, that of course is really helpful. And those cats that have more complicated underlying diseases, like the pancreatitis that Rosie had, can be more challenging. But again, doing what we can to address those is definitely helpful. But because the mainstay of management is a combination of diet and insulin, I thought this was probably the time point. I wouldn't normally say what's the general outcome with diabetes at this point, but I think if you were recently given news that your cat had diabetes, you'll probably be thinking, oh wow, insulin injections and a special diet. This sounds quite a lot and quite frightening. What does this mean for my cat, and what is the likely outcome? And in the vet world, we often struggle with getting good data published. We don't have the resources that health services for people have. So our case series tend to be a lot smaller in terms of publications. But there was a nice publication a few years ago, which reported more than 100 cats with diabetes, which in vet research studies is a really huge study. So very grateful to the authors of this paper for sharing their information with the rest of us. And in this study of 114 cats with diabetes, what they reported overall in terms of the prognosis was that about half the cats lived for more than 2 years with this disease. and the overall median survival was 516 days, so just a bit under 2 years. Some cats were, for a variety of reasons, euthanized at the time of diagnosis, sometimes because there was a concurrent condition which was also very difficult to manage. Some cats had very severe ketoacidosis, this emergency condition, which can be fatal in some cases. So the range of outcomes in this study was quite large, from a few days to many years, but it is a serious illness. Nonetheless, I think for many cats, they will do well with management. So if you can cope with that diagnosis and you think you can manage it, then I think this is what you might expect to see, a sort of median survival of hopefully a couple of years. So diet, I mentioned, is really important as far as management of diabetes. And over the years, a number of different diets have been tried in cats with diabetes, following the same sort of pathways that are used in other species, so dogs and people, for example. And what's emerged is that for cats, what seems to work best is a diet that is very low in carbohydrate. So sometimes a diet that is analogous, or in some ways analogous, to the Atkins diet, which was very, very popular maybe 10, 20 years ago. So the Catkins diet, you might call it from a feline perspective, but this is typically a low carbohydrate and a high protein diet. And in fact, cats do have very high protein requirements anyway. And if you think about their sort of normal diet in the wild being lots of little mice and other small rodents, then that too is a diet that is actually very low in carbohydrates, and their physiology is just not very good at dealing with carbohydrates. But a lot of modern diets that are available for cat food do have carbohydrate in them, and certainly dry foods actually need a certain amount of carbohydrate just to hold that kibble together. It's really, really hard to get a low carbohydrate dry food. There are some available, some therapeutic diets which are very good, which are available, but it is apparently very hard work to formulate those foods, because having that carbohydrate helps that kibble biscuit stay together. So this is why, one reason why I've put a wet food is preferred, because in general you can get a lower carbohydrate wet food than you can with a dry food. Also remember that your cat with diabetes does have quite high fluid requirements because of their diabetic state. Even if a well-controlled diabetic cat is going to have high blood glucose at some points, and that is going to result in this loss of glucose in the urine, taking water with it, so a larger volume of urine produced, meaning that cat is vulnerable to dehydration if they don't also drink more. So if you could absolutely dictate what your cat with diabetes ate, in my mind, it would ideally be a therapeutic diet. So that's one designed for diabetic cats, but also the wet formulation where possible. And if the cat doesn't like wet foods, then the dry formulation of the therapeutic diet is definitely the best dry food, rather than a standard sort of supermarket dry food, if you like. There are other modifications that often are made to therapeutic diabetic diets. A lot of the pet food companies have spent decades researching all sorts of illnesses that our small animals get, and they've put that knowledge into their foods. And so, for example, having L-carnitine, antioxidants, vitamin E is also thought to be beneficial in terms of supporting that sort of healthy metabolism and healthy glycemic control. And we certainly know that overall feeding these low carbohydrate diets to cats with diabetes is associated with a better outcome. In combination with insulin, we tend to find, firstly, a higher chance of diabetic remission. And secondly, those cats that do need insulin lifelong will have lower dose requirements if they're also on a therapeutic diabetic diet. If your cat will not eat a therapeutic diabetic diet, then don't beat yourself up, because there is only so much you can do to encourage your cat to transition to the diet of your choice. So my advice there would be, certainly try the different brands, because there are a number of different brands available. For example, Hills, Royal Canin, Purina would be brands that I'm extremely familiar with and use their diabetic diets. So you have a few different formulations and a few different companies to work through. But if your cat proves, it really will not eat those diets, then ideally as lower carbohydrate a diet as possible. Kitten food was used in some of the original studies, so that might be worth a try for your cat because it tends to be higher in protein and lower carbohydrate. But also just bear in mind that, you know, if your cat will still only eat, let's say, the supermarket food for an adult cat, you are still doing your best in every other way to support their diabetes. What about meal times and diabetic cats? Well, cats actually don't tend to have much blood glucose fluctuation after a meal time. So with ourselves, when we eat a meal, often after that meal, our blood glucose levels will increase and you will see what's called a postprandial hyperglycemia. But that doesn't appear to be as common a phenomenon in cats. And actually for that reason, often with diabetic cats, I will keep them on whatever food regime they were on prior to their diagnosis. So some cats are meal eaters, and that's the way they've always eaten. They have maybe 2 or 3 or 4 meals a day from their carer. Other cats will be fed ad lib. And if that's the way the cat has been fed at the time its diabetes is diagnosed, then I won't usually change that because of the fact that cats are less vulnerable to this postprandial change in their blood glucose level. But as with all things, of course, talk with your vet who knows your cat personally and can provide the very best advice for you regarding their care. So that concludes really what I wanted to say about diets. Obviously, the aim is that the low carbohydrate diet assists in glycemic control, and then we want to maintain a healthy body weight. So help that overweight cat to lose weight, help that underweight cat, that's the cat that's lost weight because of its diabetes, to gain weight, and then maintain a healthy, stable weight going forwards. Insulin is the next ingredient to our successful treatment plan, and the majority of diabetic cats do need and do benefit from insulin therapy. And in the UK, we have 2 licensed insulins for management of diabetes in cats. We have one that is called can-insulin, which is a intermediate duration insulin, so it's a relatively short acting insulin, and that is available in little bottles, the picture on the left hand side, but also in a pen formulation, which some carers find preferable to use. Certainly can be a little bit easier with cats that are on very low doses, and most cats will just be on 2 or 3 units of insulin, quite a tiny dose to load up into a syringe. It's important that when you use the insulin bottles that you use the correct syringes with them. The veterinary insulins, which include that can-insulin, the intermediate acting insulin, and Prozinc, which is a longer acting insulin, which would be generally the first choice now that this is available as an insulin for cats because of its length of action being that little bit longer. Both of these are 40 units of insulin per mil. Most human insulins are 100 units per mil, and the really key thing is to use the right syringe. You will get syringes that are designed for 40 units per mil and syringes that are designed for 100 units per mil, and it's really important to use the right one with the right insulin, and of course your vet clinic would definitely help you with that. In terms of which of these insulins, as I've just mentioned, the consensus currently is that if a cat is diagnosed with diabetes today, the preference is for it to be prescribed a longer acting insulin twice a day. So the Prozinc of the licensed preparations would be the preferred insulin to prescribe for most cats, because based on its duration of action, given twice a day, that tends to achieve better control than can-insulin, which is a shorter acting insulin. Having said that, of course, all cats are different, and some cats will do better on can-insulin because of the way they metabolize insulin. So this is not a generalization that should be taken as, you know, absolutely definitive for all cats. As with everything, we need to consider the individual. And there are indeed in other countries different insulins, human insulins, which are used in stabilizing cats. But under our regulatory guidelines, we in the UK are obliged to use the veterinary licensed formulations where those exist, and that is the CAN insulin and the Prozinc. But I will mention insulin glargine in just a moment because it is used in some cases in the UK, but also around the world is extremely popular, and that's a human insulin. So in general, principles of insulin therapy are that typically your insulin needs to be kept in a fridge. The bottle should be upright. You don't want it sort of lying on its side or upside down because it can stick to the rubber bung in the bottle. You need to make sure that you use it within the recommended time period. So typically that's going to be certainly no more than 2 or 3 months for a bottle, but depending on the preparation, you may be recommended to change that every month. And certainly if you try and stretch it out, that might mean that perhaps that insulin is less effective if you do that. We are very cautious, as I've already said, about insulin dosing in cats. So we tend to start at quite a low dose, 1/4 to 1/2 a unit per kilogram body weight, and just increase that dose very gently and very slowly as needed. So typically not more often than every 3 days. So maybe twice a week, but maybe not even that often. And just going up in little baby steps, because we know for some cats, actually, it could take a few days for the full impact of that new dose to be evident. And what we don't want to do is to overdose our cats with insulin, because that is potentially very serious in causing this hypoglycemia, which could cause fits or coma or even death. So we take it gently. And as a carer, I would say key message to you is to, of course, follow the instructions that you receive from your vet clinic, and don't change the dose of insulin unless advised to do so by your vet clinic. And if in doubt, of course, contact your vet clinic for any clarification. So I said I would mention insulin glargine just briefly because it is certainly used in the UK. We are, as I mentioned earlier on, we are obliged to use the veterinary licensed formulations of insulin as our first choice. So today I would, with a newly diagnosed diabetic cat, use Prozinc, the longer acting insulin, as my first choice. And if that doesn't seem to be suiting the cat very well, then unless I was seeing very prolonged duration of action, in which case I might try the shorter acting CAN insulin, I would probably go to glargine. And glargine is an interesting insulin. It's a recombinant human insulin, so it's a little bit different to the cat insulin, and this clear solution that forms little precipitates of insulin under the skin once you're injected into the cat, and then is released very slowly over several hours. And so it's often referred to as a peakless insulin, because you're not giving that full dose to the cat in one go because of the way that the insulin behaves in the body. It forms these little crystals, which then just slowly release over a period of time. It's been studied very extensively by a very well-known veterinary endocrinologist called Jackie Rand, who is an Australian vet. And you'll see, if you do a Google search for Jackie Rand, so I think Jackie with a Q, you will find lots and lots of papers that she's written about use of glargine in cats, and had extremely good results, and tending to get better diabetic remission results than we see in the UK with our veterinary insulins that are available. However, as I've said, we're not allowed to use this as our first choice insulin. And indeed, lots and lots of cats do extremely well on CAN insulin and Prozinc. For people who worry about injections, and of course, who wouldn't in many ways, you might be thinking, well, in diabetic people, I know some people take tablets, is the same available for cats? And people have used these, what are called oral hypoglycemic therapies in cats as well. And probably the main one that has been used, and which I've used myself in some cases, is a product called glipizide. This is, there's a picture here of one of the available formulations of glipizide. And glipizide is in a group of drugs called sulfonylureas, and these are medications that have a number of effects, including stimulating insulin production and insulin release by the pancreas. So they can bring down blood sugar, and they can in some cases be effective. However, they tend not to be used very frequently because overall they are far less effective than insulin, and also can be associated with side effects, for example, side effects to the liver. So I have used glipizide in a handful of patients, and I would say without massive success. And the situations where it's tended to be requested have been situations where perhaps the carer of the cat is just unable for whatever reason to administer an insulin injection, but they are able to administer a pill, so we try this first, but sadly it's often not that effective. Some exciting news in the future, and apologies that this slide has just got a huge number of words on it, but there are some interesting studies going on in the cat world as well as the human world in terms of diabetes, and one interesting possible future treatment is something called exenatide, which is an incretin analog, and these incretins are produced in the body and again stimulate insulin secretion, and there has been a study published, this is the summary of which is shown on this slide, whereby very good results were achieved with using this as an injection, and in this study once a week injection, which also is, I think, quite a nice thought in terms of frequency of injections compared to obviously our normal insulin is twice a day, and actually these cats still needed insulin, but they got more cats into remission with using this exenatide as well. So this may be a future possibility available for our cats, and that might help. So I want to spend just the next 15 minutes talking about how we monitor success of treatment of diabetes. And this is actually an area where input from the carer, input from you, is actually, in my opinion, generally more helpful than anything that can be done in the clinic. And we can make a lot of decisions based on the sort of information that we get from home as to how things are going. There are lots of things that we can follow. We can monitor, as I've put here, the cat's demeanor. So key thing here really is that most diabetic cats are quite bright and cheerful. If your cat becomes listless, lethargic, depressed, that may contact your vet clinic. And then in terms of the stability of their diabetes, looking at things like appetite, thirst, body weight, amount of urine passed, whether there's glucose in the urine, blood glucose levels, and the fructosamine test, which I'll explain, are all things that can help, but some things are more helpful than others. And the first thing that I think is really incredibly helpful is actually thirst and urination. So as you'll remember, cats with diabetes, if they have high blood sugar levels, lots of glucose is passed into their urine, and that takes water with it, which means they produce a large volume of urine with glucose in it, and then they have to drink a lot to stop themselves from becoming dehydrated. And there is a very good correlation between a cat's thirst, their water intake, and how well stabilized the diabetes is. And this is something that you may be able to get crude information from at home. For example, just literally noticing, well, how often is my cat visiting the water bowl, roughly how often they're drinking. But even better is it actually if you can measure it in some way. And even in multi-cat or multi-animal households, there is a benefit to measuring how much water is being consumed in the household, because in general any variation from day to day is going to be due to that diabetic cat and what's happening with it. So it still can be very helpful, but of course it's easier if you've just got one cat to monitor. Also looking at the amount of urine passed, so perhaps the size and the number of urine clumps, again, easiest if you've just got one cat, the weight of the litter tray, but even in a multi-animal household, if you normally say get, 6 urine clumps per day, and your cat develops diabetes and that goes up to 10 urine clumps a day, then when it goes back down to 6 again, well, yeah, that's back to normal. So that's looking quite good. So all these things can be really helpful. And from my perspective, really, what we want to see is that with management of the diabetes, the thirst returns to normal, the urination returns to normal. And what we don't want to see are large variations day to day or through the week in the thirst and how much urine is passed. Also importantly for our cats, particularly in the early stages of their diabetes being stabilized, is if that thirst returns to normal, that cat may be entering diabetic remission. And that again is a time to speak to your vet and say, my cat's thirst has completely gone back to normal. You know, what should I do to make sure that I'm monitoring for diabetic remission? And we'll talk about urine monitoring a little bit later. So I showed you a picture of Toot a little bit earlier on. This is Toot, or Toots in the picture here. And Toot's owner was very, very good at monitoring water intake. And I just took a few photos of some of the water intake logs that he provided to me. And each line actually shows water consumption over a 12-hour period. So depending on what screen size you're looking at and whether you can read this, I can tell you that at the start of Toot's diabetes, she was drinking 400 or 500 mils of water each day, which is a huge amount for a cat to be drinking. But as the diabetes came under control, that fell to about 100 mils per day, which is still actually a little bit higher than many cats would drink, because actually she was on a wet diet. So many cats on a wet food don't really drink at all, but she did have some kidney disease. She was quite an elderly cat, so that accounted for that thirst. But nonetheless, we could see 500 when bad, about 100 when things are going well. And then the useful thing about this was that we had a few blips in our diabetic management as time goes on. That's not unusual. And so when Toots's thirst increased, her owner was very aware of it, contacted me for advice, and an example of one cause of one of those blips was actually a urinary tract infection, which diabetic cats are vulnerable to, and that increases insulin requirements. But once you treat the infection, the diabetes comes back under control again. So really useful to have that sort of data. Blood glucose data can also be helpful, but it is a little bit limited because, as we talked about last week, cats unfortunately can have a stress-associated increase in their blood sugar levels, what we call a stress-associated hyperglycemia. And that means it's not always easy to interpret blood glucose readings, particularly at the clinic, and particularly if the cat has had any sort of struggles when blood sampling has been done. It can just mean that the results can be meaningless, very, very difficult to interpret. Those cats that don't get a stress increase in blood glucose, then looking at blood glucose levels can be helpful though, particularly if things don't seem to be quite going to plan in terms of stabilizing the diabetes. Because if we take samples and look at blood glucose levels through the day, we can see, well, is the blood glucose dropping into the reference range, which is what we want to happen after our insulin injection? How long is it staying low? Is our insulin lasting long enough? Do we need to give our insulin more frequently, or do we need to give a higher dose? So monitoring blood glucose can be helpful. And this is also something that can be done at home. And I'll show you a few pictures of that in just a moment. So your vets may say, if your cat is diabetic, we'd like to do a glucose curve. And a glucose curve is where we take frequent samples, typically every 1 to 2 hours through the day, to see what is happening to that glucose level. Is it responding to the insulin? Are we giving a high enough dose? Is the insulin lasting long enough? And we can see just how the insulin is working out for that cat. And that can help us in the future if we want to decide, right, well, you know, X o'clock and Y o'clock are the times where we want to get samples in the future, because that looks like it's when blood glucose is at its lowest, for example. So in a hypothetical sort of perfect case, a glucose curve might look a little bit like the example I've shown on this slide, where we've got the glucose reading in millimoles on the y-axis going from 0 to 20. And then on the x-axis along the slide, we've got time in hours. So from -1 through to time 0, which is when the insulin has been given, and the following 12 hours. The red box is really where we would like our blood glucose to be for as much of the day as possible, because that's between about 5 and 12 millimoles per litre, which is below the renal threshold. So hopefully our cat will be free of clinical signs of diabetes, but not too low to worry about hypoglycemia. And you can see that the green line here, which is our hypothetical glucose curve, shows that before insulin is given, this cat's blood glucose is 15 or 16. After insulin, the blood glucose levels come down. They stay within that red box for much of the next 12 hours before coming back up again. And you can see that the insulin at its peak, the lowest blood glucose level, is about 4 to 6 hours after the injection. And that is giving a blood sugar of about 6 millimoles per litre, which is absolutely fine. We're not having to worry about levels being too low. But we can also see that the insulin is lasting for most of the 12 hours as well. So this is the sort of information we get. And some cats will tolerate you doing glucose monitoring at home. And so this is something worth considering. And International Cat Care have got a nice video, which you can look up on YouTube. It's called Home Blood Glucose Testing. And that runs through the technique, but I've just extracted some stills from that video. And it shows how to collect a blood sample from the ear vein of a cat. So the ear is quite thin-skinned, and it has this peripheral vein that goes around the edge of the ear, and shining a light through the ear. You can see on this image, you can see that vein. And if you warm the ear slightly and put a little bit of Vaseline over the fur, that helps a little bleb of blood form when you very gently poke that vein with your needle, and then you can collect a tiny amount of blood for your glucometer. And the glucometer, the glucose reading device, these days they require just tiny amounts of blood. So that drop of blood is enough for probably about 20 tests. It's absolutely loads, but is not going to be compromising the cat in terms of blood loss either. So that might be a helpful video to look at. And something else that has recently been gaining a huge amount of popularity is a device which was designed for use in people, but now people are using in cats and dogs as well with diabetes. And this is called a Freestyle Libre, which is an indwelling device, which you can see this sort of circular disc, which has a little tiny sensor which pokes through the skin and assesses the glucose levels in the interstitial space, the space between the cells, on a very continuous fashion. And you synchronize this with your smartphone and download the data, and then you can, for up to a couple of weeks, collect data from that cat every day and see how effective your management is. So it's something that I would say is not needed if things are going well, but if things are not going so well and you're thinking, oh, what exactly is happening here, this could be a useful thing also to talk about with your vet. And the sort of data you get might look like this. This is some data from a patient called George, and you can see there are 3 different graphs shown on this slide. The green band is broadly where you would like the blood glucose to be for as much time as possible. I would probably extend it up a notch to the 12 millimole per litre level, but you can see that George is absolutely not controlled at this point. The graph on the right at 0 times of the day is his blood sugar within the region we would like it to be. The graph in the middle shows him having actually a little bit of a hypo, and often when your blood glucose goes low, the body throws all it can at it hormonally to return blood glucose levels, and you tend to get then an overswing, so a hyperglycemia, which is where the blood glucose levels shoot up again, and that seems to be happening here. And the next dose of insulin has not had quite as much of a hit, so the trough level is not quite as low, probably because of that overswing hyperglycemia that George has had. So these sort of devices definitely can shed light on control, but probably also more traditionally would be this test, the fructosamine test, which if you've had a diabetic cat, your cat will probably have had one of these. Fructosamine is a complex between glucose in the bloodstream and protein in the bloodstream, specifically albumin. And if there is long enough time for glucose to bind to albumin, it will do so and form this complex fructosamine. And if there is a lot of glucose in the bloodstream, which of course there is in a cat with diabetes, then you will have a lot of fructosamine. So it can be helpful in diagnosing diabetes, but also in assessing control of diabetes. And typically, a cat with well-controlled diabetes will have fructosamine levels below 450. They may even be below 300, which would be a sort of normal result. But a poorly controlled cat may have a fructosamine of, well, certainly more than 450, often, maybe 600 or 700. And that again tells you, well, blood sugar levels have obviously been high, very high for a significant amount of time over the previous 2 to 3 weeks, which is the half-life of fructosamine. Therefore, my diabetic control is not as good as it could be, and I need to do something about it. Urine monitoring also I mentioned. So in the urine, what we're wanting to monitor is firstly absence of ketones. If you find ketones in the urine, that's a definite call your vet emergency situation. But also for our diabetic cats, we want to, generally we expect to see some glucose. We obviously don't want there to be loads and loads of glucose, but we generally expect some glucose. And if there is no glucose, that again raises the possibility that the cat may have gone into this diabetic remission. The diabetes may be under control. So again, that would be a situation to speak to your vet and say, there's not any glucose in the urine, what should I do? Should I change my management? So often what I would say, if at all possible, is particularly in the early stages of stabilizing your cat, if you can at home, monitor the urine twice a week, just gives you an idea as to what's going on. And of course, if you're concerned for cat's unwell, that again is the time to maybe check for ketones. Although if there are no ketones, I would still contact your vet urgently if your cat is unwell, because not all ketones are detected by the dipsticks. We also can monitor the cat for other things, so urine infections, and sometimes as part of a urine infection there will be blood in the urine, and Royal Canin have these granules called their hematuria detection granules, or blue care detection, or blue care granules rather, that you can put onto the litter, and they go blue even with tiny weeny amounts of blood in it. So if your cat has had previous problems with infection, having that blue care product sprinkled on your cat litter might help you as a bit of an early warning system. And contact your vet definitely if there's ketones, if there's no glucose, or if the glucose levels seem to vary very much, then that again is all things that your vet would want to hear about. Monitoring body weight, really helpful. We know that we want cats that are well controlled to have a healthy body weight that is stable. So if you can invest in some scales for home monitoring, that I think is helpful. And there are lots of, I think, quite inexpensive scales now available on the likes of eBay and Amazon. Keeping a diary of all these things can definitely be helpful, and feeding back that information to your vets. So noting down what dose of insulin you're administering, when it's being given, how your cat is behaving, how much food they're eating, how much water they're drinking, all these sorts of things can be really, really helpful, as well as the urine monitoring we've talked about. Initially with my diabetic cats, I would want to be in quite close contact with their carer. So a weekly check, body weight check, general check. We're going to be probably tweaking the insulin in those first few weeks gently to try and stabilize things. And then of course, assess fructosamine, perhaps do a glucose curve if we're not quite sure how things are working out, perhaps consider a Freestyle Libre if again we need a bit more information. But for many cats we can stabilize them, and for a proportion of cats, as we've mentioned, we might get diabetic remission, and some clinicians, as I mentioned, get very, very good results for diabetic remission. So again, Jackie Rand using glargine reports up to 80% of the cases she sees entering diabetic remission, and this is prompt and quite aggressive management of the diabetes with insulin that is associated with the best results, and also using that therapeutic diet that we talked about. But I would say from my own experience, it's probably more like a third to possibly half of the diabetic cats that I would see where diabetic remission might occur. But do all you can, of course, to help that. So if your cat is overweight, like Mr. Bugs was, losing weight, manage that pancreatitis if you can, remove those diabetogenic drugs if you can. All those sort of things definitely help. But these cats, remember, will probably be vulnerable to developing diabetes in the future. So final key points, diabetes is quite a common disease. It's not the most common endocrinopathy. Hypothyroidism is the most common hormonal disease, but diabetes is number 2. Obesity, definitely a risk factor. So if your cat is overweight, that's definitely something to be aware of. Also, as we talked about last week, certain breeds like Burmese cats have an increased risk of diabetes. Routine screening for this, well, iCat Care would recommend a routine urinalysis in cats aged 7 years and over, and one of the reasons for that is to screen for diabetes. So monitoring urine is definitely helpful in my opinion. And in terms of management of diabetes, it's that combination of therapeutic diets designed for diabetic cats plus insulin that generally results in the best outcome. But as always, all cases are different, so speak to your vet. They know your cat best and can advise you on what is the best approach for your cat and your situation. But home monitoring, certainly from my perspective, provides really massive input, very, very important input to case management. And often if I have good data from the carer and it's and slightly contradictory data from perhaps the fructosamine test, I'm more likely to trust, if you like, the data from you. And that includes things like body weight, appetite, thirst, than a lab result. So the data you collect is extremely valuable in my opinion. As always, there are some resources on the website that are relevant for this presentation. So for example, in terms of supporting fluid intake, we have a download on that. So don't forget to have a look at the website. The plan for next time's Cat Cafe is that firstly, we've had to shift the date slightly from what was planned because of other commitments my end. So it's now a little bit of a pre-Christmas Cat Cafe, the 17th of December. I hope you'll be free to join me. And my plan for that session is to talk firstly about some results from an owner survey, carers of cats with diabetes, which you may well have contributed to. And this is a publication that you can read a little snippet about on the website as well, but I'll present a little bit more detail from that. Really interesting results. And also we can just have an informal Q&A and discussion about anything that you would like to discuss. And I think that the survey part of things I will probably try and tailor to about 20 minutes. So we have got a bit more time for whatever questions you might like to ask pre-Christmas. And then the final thing to say is survey-wise, we have got a new survey that we're supporting and involved with is about coughing cats, cats with asthma, bronchitis, or other causes of chronic coughs, so coughs that are lasting for several months or longer. And if you are able to participate in that, we'd be very grateful. We've sent out, I think, one email about this and one Facebook post. It will be on the website shortly, if not already quite there, and we will be sending out more mailings, but we would really love to have your participation in that study. Other studies that are still open include early neutering of cats, which is open to all cat owners, and also the squinting cat survey, so prevalence of squints and nystagmus, the flickery eyes in certain breeds of cats, including Burmese and ragdoll cats, for example, which is open to anyone who has a cat of that breed, whether or not they have a squint. So they don't have to have a squint. We just want to hear from owners of certain breeds. And it is quite a long list of breeds, but it is sort of Burmese and related breeds. So sorry that went on for a little bit longer than I had planned, but I hope that was helpful. And I will very happily answer any questions that you might have. Thank you very much.